Contagion is a good movie. It's a really good movie. And that's because, unlike many Hollywood blockbusters, it actually gets the science right due to quality consulting by actual scientists like Dr. Ian Lipkin of Columbia University. But it's been discussed a lot in the news and social media lately, not because the science is so good, although it is, but because people see a number of similarities between the MEV1 pandemic that is modeled in the movie Contagion and our actual real-world pandemic of COVID-19 that is happening today. I put together this short video to address 4 key ways in which COVID-19 is not MEV1 from the movie Contagion. Reason number 1 is that the case fatality rate for MEV1 is much higher than we have generally seen for COVID-19. A case fatality rate is simply a measure of the proportion of all individuals who contract the disease that die. So for MEV1, it was 25%, meaning that in the movie it stated that 1 out of every 4 individuals that contracts MEV1 dies of the disease. For COVID-19, the case fatality rate varies from setting to setting and relies a lot on the level of care that's available in those settings, as well as how accurate of a number we have of the true denominator of all cases, including ones that may have less severe symptoms. But it generally ranges from about 0.7% in areas where hospital systems are not overwhelmed and where medical professionals are able to continue to render care to patients that are having severe or critical manifestations of the disease, to around 5 to maybe 7% in areas where hospital systems do become overwhelmed and aren't able to keep up with demand. That brings me to item number 2 as to why MEV1 and pandemic COVID-19 are not the same actual phenomenon. So with MEV1 from the movie Contagion, we see a very swift progression from the onset of initial symptoms to severe disease to death. That swift progression doesn't allow much time for the initiation of care and treatment. With COVID-19, we see much more variable symptoms, and we also tend to see a somewhat more gradual progression from initial onset to severe disease to, in some cases, death, which allows for more opportunities to implement treatment, which brings me to item number 3. We have seen with COVID-19 that mechanical ventilation and supportive care can be highly effective in trying to treat individuals with severe COVID-19, and that can increase the likelihood of survival, whereas we don't see the use of these measures in the movie Contagion as having a meaningful effect on the progression of disease or outcomes for the patients. And reason 4 is that in the movie Contagion, there's not really much discussion of the use of any antiviral drugs as effective treatment. It comes up briefly in one press conference, but otherwise isn't mentioned much. With our current unfolding pandemic of COVID-19, however, there is a candidate drug, remdesivir, that was already in development that's been tested in animal models for SARS and MERS that potentially shows some promise for treating COVID-19 in people that are already infected with the disease, and is already being used in a compassionate care protocol in Washington State and elsewhere in the United States, Italy, and China. So I bring these 4 key distinctions between MEV1 and COVID-19 to you, not from any intention to downplay the very real risk that COVID-19 poses to human society and human health. It is serious. It needs to be addressed appropriately. Different measures to socially distance individuals, and then also to implement intensive measures to isolate and care for the sick, as well as other economic and social measures to support people through the disruption that all of this caused, are absolutely essential and should not be ignored. But blockbuster movies are not fact, and I wanted to just simply highlight a few ways in which our current, admittedly very challenging unfolding pandemic may not be quite the dystopian, bleak depiction that we see in the movie Contagion. Thank you very much.